cardiac surgeon, warns this drug is damaging the hearts of older adults. As a cardiac surgeon who has spent 2 decades meticulously mending and understanding the human heart, I am compelled to share a truth that is both unsettling and profoundly important. A truth that could be the key to safeguarding the longevity and vitality of your most crucial organ. What I am about to unveil might truly shock you, for the potential danger I speak of isn't hidden in obscure corners of pharmaceutical research, but rather in the very medications that populate our bathroom cabinets, trusted daily by millions. I am Dr. Michael Kent, and my experience in the operating room has offered a unique, often heartbreaking perspective. I've witnessed countless individuals, otherwise robust and healthy, enter my surgical suite not because of a sudden, unforeseen illness, but because their hearts have been quietly, insidiously damaged by prescriptions and over-the-counter remedies they believe to be entirely benign, even protective. These aren't some experimental concoctions or rare drugs. I'm referring to the common pain reliever you might have taken with your morning coffee, the stomach pill swallowed routinely with breakfast, or even the cold medicine you instinctively reached for just last week without a second thought. My professional oath demands that I expose what contradicts much of what you've been led to believe about the safety profiles of these ubiquitous medications, especially as we age. The pharmaceutical giants, driven by profit and market dominance, often prefer that such inconvenient truths remain obscured. Many well-meaning doctors, caught in the rapid currents of modern medicine, simply aren't fully apprised of the devastating, subtle connections between these drugs and long-term cardiac health. But I have seen the undeniable pattern emerge, patient after patient, heart after heart, and I can no longer afford the luxury of silence. By the conclusion of this crucial message, you will possess a clear and actionable understanding of precisely which 5 categories of medications are subtly yet powerfully undermining your heart muscle, why their risks become exponentially magnified after the age of 60, and most critically, the practical steps you can implement today to shield yourself and your loved ones from potential harm. This is not designed to incite unwarranted alarm. Instead, it is an urgent delivery of life-saving information grounded in clinical reality and decades of observation. Please stay with me, absorb every detail, because the knowledge you are about to acquire has the genuine potential to add not just months, but tangible, vibrant years to your life, allowing you to live with greater strength and peace of mind. Let's embark on this vital exploration by addressing the medications found in virtually every household across America, and indeed, much of the developed world, the non-steroidal anti-inflammatory drugs, universally known as NSAIDs. These include familiar names such as ibuprofen, naproxen, and diclofenac, readily available and often considered the first line of defense for a wide array of discomforts. They are your immediate go-to remedy for the throbbing headache that disrupts your day, the persistent back pain that limits your mobility, the nagging joint stiffness of arthritis, or any general muscle ache. Undeniably, their efficacy in alleviating acute pain and reducing inflammation is brilliant. There is no disputing their immediate symptomatic relief. However, here lies the profoundly important caveat that is seldom communicated with the necessary gravity. Regular or prolonged use of these seemingly innocuous pills after the age of 60, particularly if you have any pre-existing heart conditions or risk factors, is akin to engaging in a perilous game of Russian roulette with your entire cardiovascular system. The medical establishment, often slower to disseminate inconvenient truths widely, has been aware of this insidious danger for several decades. As far back as 2005, the U.S. Food and Drug Administration, FDA, recognized the severity of these risks, mandating explicit, bold warnings on NSAID packaging about increased risks of heart attack and stroke. Yet, despite these official declarations, millions of individuals continue to consume them daily with the casualness of candy, tragically unaware of the silent, accumulating danger that can lurk within each tablet. Allow me to illustrate this stark reality with the story of Michael, a vivacious 72-year-old gentleman whose greatest joy was tending to his meticulously kept garden. He battled chronic knee arthritis, a condition that, while painful, never dampened his spirit. To manage the incessant discomfort, Michael consistently relied on ibuprofen, often taking it almost every single day, believing it to be a harmless necessity for maintaining his active lifestyle. One balmy afternoon, while engrossed in pruning his beloved rose bushes, a sudden and profound sense of exhaustion washed over him. He found himself utterly unable to catch his breath, his chest feeling constricted, and to his alarm, his ankles had swollen to an alarming 2 times their normal size. His concerned wife rushed him to the emergency room, where we made a sobering diagnosis. Michael was experiencing acute heart failure, his heart already working diligently over time due to the natural stiffening that comes with age, and a previously manageable mild hypertension simply could no longer cope with the added strain. The critical revelation was that the trigger for this sudden cardiac decompensation wasn't a newly developed heart condition, but rather the cumulative, continuous use of that seemingly innocent anti-inflammatory pill. The mechanism by which something so commonplace can become so acutely dangerous is insidious and multifaceted. NSAIDs function by blocking specific enzymes, primarily cyclooxygenase, COX-1 and COX-2, which are pivotal in the production of prostaglandins, substances that mediate inflammation and pain. While this action effectively reduces discomfort, it simultaneously and inadvertently disrupts the production of other crucial prostaglandins that play vital protective roles for your kidneys and blood vessels. This intricate interference cascades into 2 catastrophically detrimental effects on the cardiovascular system. First, NSAIDs compel your body to retain an excess of salt and water. To visualize this, imagine your heart not merely as a muscle, but as a meticulously engineered pump within a vast network of plumbing. If, abruptly, there is a significantly increased volume of fluid circulating within those pipes, your bloodstream, that pump is forced to labor at its absolute maximum capacity, straining against an overwhelming load. A young, resilient heart, perhaps, can momentarily withstand this extraordinary stress. However, a heart that is already contending with the inherent age-related stiffening of its muscle tissue, or one that is already fighting valiantly against the persistent challenge of high blood pressure, can falter and fail completely under such an exacerbated workload, much like Michael's did. Second, and equally perilous, NSAIDs possess the capability to constrict your blood vessels and significantly elevate systemic blood pressure. Even if you have never been diagnosed with hypertension, regular habitual use of these drugs can cause your blood pressure readings to climb to concerning levels. Furthermore, if you are already diligently taking prescribed medication to manage high blood pressure, NSAIDs can, with alarming efficiency, completely nullify or severely counteract the beneficial effects of those medications, sending your blood pressure soaring to dangerous altitudes without any discernible warning or realization on your part. It is absolutely crucial to grasp that the magnitude of this cardiac risk is directly proportional to both the dose and the duration of NSAID use. Higher potency drugs like diclofenac and elevated doses of ibuprofen, typically around 2,400 milligrams daily, are the most unequivocally and strongly associated with a heightened incidence of cardiac problems. Low-dose naproxen appears to carry a comparatively lower risk, suggesting a nuance in choice, but it is imperative to remember that the risk is never, under any circumstances, truly zero. And here is another astonishing revelation that further complicates the picture. If you are conscientiously taking low-dose aspirin as a preventative measure to protect your heart from clot formation, certain NSAIDs, most notably ibuprofen, can actually completely neutralize that vital protective effect. They can block aspirin's ability to inhibit platelet aggregation, rendering your heart's guardian useless. So, what then is the prudent course of action? The answer is emphatically not to stoically endure debilitating pain. The genuine solution lies in fostering an honest, transparent, and detailed conversation with your primary care physician or cardiologist. Ask them directly, unequivocally, "Doctor, given my specific medical history, my age, and my existing health conditions, what constitutes the safest and most effective pain relief option for me?" Numerous viable and safer alternatives genuinely exist. In many instances, acetaminophen, paracetamol can provide sufficient relief without the cardiovascular risks. Other times, topical anti-inflammatory creams or gels, which work locally at the site of pain with minimal systemic absorption, present excellent and significantly safer choices. Should an NSAID be deemed absolutely indispensable for a particular condition, the golden rule, etched in medical wisdom, is to utilize the absolute lowest effective dose for the shortest possible duration under strict medical supervision. Now, we move to the next category of concern, number 4 on our list. This one, I assure you, will absolutely surprise you, primarily because it is so widely and vigorously marketed as a protective agent for the stomach. I am referring to proton pump inhibitors, or PPIs, by their more common acronym. Medications such as omeprazole, pantoprazole, and lansoprazole are among the most frequently prescribed drugs globally, consumed by millions. Many individuals incorporate them into their daily morning ritual, taking them for chronic acid reflux, or ostensibly to shield their stomach lining from the potential irritant effects of other medications. Ironically, sometimes even from the very NSAIDs we've just discussed. And here lies the profound, bitter irony. The very medication prescribed with the intention of safeguarding you from one health risk might, in an unforeseen twist, be inadvertently creating another, potentially more serious, danger through the back door of your body's intricate systems. Let me recount the pertinent story of Helen, a vibrant 68-year-old woman who was prescribed omeprazole to manage her persistent, often debilitating, chronic acid reflux. She was explicitly instructed by her physician to take this medication indefinitely, effectively for life, a common, yet often questionable, long-term recommendation. Her acid reflux symptoms, much to her relief, indeed vanished, and she, like millions of others, never once questioned the long-term implications or necessity of her daily pill. Years later, during a routine but thorough annual physical examination, her electrocardiogram revealed an unusual pattern and subtle anomaly that warranted further investigation. Subsequent blood work conclusively pinpointed the underlying cause. Her magnesium levels had plummeted to a dangerously low, life-threatening concentration. Magnesium, often called the master mineral, plays an indispensable role. It is the veritable guardian of your heart's intricate electrical rhythm, a conductor orchestrating a complex symphony. When this vital mineral is severely depleted, your heart's electrical system becomes profoundly unstable, much like an orchestra suddenly deprived of its conductor, leading to chaotic, potentially lethal arrhythmias that can emerge without warning. The undeniable cause of Helen's critical deficiency, as confirmed by her medical team, was her chronic, unchecked omeprazole use. PPIs perform their function by drastically reducing stomach acid production. However, that very stomach acidity is absolutely indispensable and crucial for the efficient absorption of numerous vital nutrients, among them magnesium. When stomach acid is suppressed, long-term, the body's ability to absorb magnesium from dietary sources collapses precipitously, but the concerns surrounding PPIs extend far beyond just magnesium depletion. There is another dimension that concerns us as medical professionals even more deeply. Multiple large-scale observational studies, conducted independently and meticulously, have consistently identified a concerning association between prolonged PPI use and a demonstrably increased risk of heart attack. While the precise causal relationship is still a subject of ongoing scientific debate and rigorous investigation, one prominent theory suggests that these drugs might, through their complex metabolic interactions, reduce the levels of nitric oxide within the body. Nitric oxide is a critically important molecule, a natural vasodilator that plays a pivotal role in maintaining the flexibility, elasticity, and health of your blood vessels. When its levels are diminished, blood vessels can gradually harden and become less pliable, a process known as endothelial dysfunction, effectively setting the insidious stage for the development of atherosclerotic plaques and, ultimately, a heart attack. The exact causal pathway might still be under scrutiny, but the consistently observed association is undeniably deeply concerning and warrants extreme caution. Additionally, specific PPIs, particularly omeprazole, can significantly interfere with the efficacy of vital antiplatelet medications, such as clopidogrel, Plavix, a drug frequently prescribed to patients after heart attacks or strokes to prevent subsequent thrombotic events. This interference can render the protective medication less effective, leaving an already vulnerable patient tragically susceptible to recurrent cardiovascular incidents. The overarching problem is that these powerful drugs, initially developed for very specific and relatively short-term treatments of typically 4 to 8 weeks, have become tragically trivialized and morphed into what is perceived as a permanent, lifelong solution for conditions that, in many instances, could be more safely and effectively managed through thoughtful lifestyle modifications, dietary changes, and alternative therapies. If you have been routinely taking a PPI for several months or even years, it is absolutely imperative that you do not abruptly discontinue it on your own, as this can lead to a rebound surge of acid production. Instead, engage in a comprehensive dialogue with your doctor. Ask probing questions. Do I truly require this medication long-term? Can we explore strategies to gradually reduce the dose, perhaps leading to discontinuation? Are there non-pharmacological alternatives or different medication classes that might be safer for my heart? And if chronic PPI use is deemed absolutely unavoidable, it becomes essential for your physician to periodically monitor your magnesium levels through regular blood tests, ensuring that this vital mineral remains within a healthy range to protect your cardiac rhythm. Before we delve into the next critical medications, which surprisingly include some seemingly innocuous remedies for simple colds, I must make a heartfelt, quick request. If the information you have absorbed so far resonates with you, if it feels genuinely valuable and potentially life-altering, I am asking for 2 simple but impactful actions. First, please consider subscribing to this channel. My fundamental mission, my driving purpose, is to provide you with crystal clear, straightforward, and evidence-based health information, devoid of medical jargon, empowering you to make the most informed and beneficial decisions for your own well-being. Second, and perhaps even more profoundly important, I urge you to share this video widely. Think about your parents, your beloved grandparents, your closest friends, or anyone in your social circle who might unknowingly be at risk. A simple click to share can initiate a vital conversation, a dialogue that has the genuine capacity to save a life, to prevent a tragedy. Your support in disseminating this critical knowledge is invaluable, and I extend my deepest gratitude for your help in this shared endeavor. Let us now proceed with number 3 on our crucial list, a category of medication that nearly everyone keeps readily at home. We have now arrived at number 3. The widely available oral decongestants intended for the common cold and flu, specifically those formulations containing active ingredients like pseudoephedrine or phenylephrine. These products are often perceived as the magic solution for that persistent, bothersome, stuffy nose that relentlessly impedes comfortable breathing and restful sleep. However, this seemingly miraculous relief can, for your heart, carry an extremely high and dangerous cost, particularly if you are already navigating the challenges of high blood pressure or any pre-existing cardiovascular disease. Let me introduce you to Margaret, a spry 75-year-old retired teacher who, despite her active lifestyle, recently succumbed to a severe congestive cold. Desperate for relief and yearning to breathe easier, she purchased a well-known, over-the-counter cold remedy containing pseudoephedrine from her local pharmacy. By the evening of the second day of taking the medication, Margaret began to experience terrifying sensations. Her heart felt as though it was vigorously pounding, threatening to burst out of her chest, accompanied by severe dizziness, that made standing precarious and an excruciating, splitting headache that blurred her vision. Her alarmed son, witnessing her distress, immediately rushed her to the hospital. Upon arrival, her blood pressure was found to be dangerously elevated through the roof, and further examinations revealed she had developed a significant cardiac arrhythmia, a chaotic disturbance in her heart's rhythm. That seemingly innocent decongestant had undeniably pushed her delicate cardiovascular system to the very brink of collapse. Why does this perilous scenario unfold? Pseudoephedrine and phenylephrine are classified as potent vasoconstrictors. Their primary pharmacological action, their fundamental job, is to constrict or narrow blood vessels. In the localized context of your nasal passages, this action is indeed beneficial because it effectively reduces the swelling of blood vessels in the mucous membranes, thereby alleviating congestion and allowing you to breathe more freely. However, the crucial point that is often overlooked is that the drug does not act exclusively or even primarily in your nose. Once absorbed into your bloodstream, it circulates throughout your entire body, systematically constricting blood vessels everywhere, from your periphery to your vital organs. This widespread vasoconstriction precipitates two dangerous consequences for the heart. First, by significantly narrowing the arterial pathways through which blood must flow, your heart is compelled to pump against a much greater, unnaturally high resistance. It's analogous to attempting to force a high volume of water through a garden hose that has been severely squeezed or kinked. The pressure within the system explodes. This increased resistance, known as afterload, can trigger a dangerously rapid and severe spike in blood pressure, placing immense strain on an already aging heart. Second, these decongestants are also potent central nervous system stimulants. They actively accelerate your heart rate, often making it beat faster and, more alarmingly, irregularly. If you already possess a heart that is sensitive, perhaps prone to palpitations or burdened by underlying cardiovascular issues, this additional powerful stimulation can completely destabilize its delicate rhythm and function, potentially leading to dangerous arrhythmias or even cardiac events. Recent regulatory actions in Europe have vigorously refocused attention on the profound risks associated with pseudoephedrine, particularly due to its documented link with rare but exceptionally serious syndromes involving the constriction of blood vessels, specifically within the brain, such as posterior reversible encephalopathy syndrome, PRES. This alarming finding only further underscores and demonstrates the powerful and pervasive systemic effect these drugs exert throughout the entire human body. The major inherent danger with these particular medications stems from their easy accessibility. They are widely available over the counter without a prescription. People routinely purchase and consume them without carefully reading the extensive fine print warnings and, crucially, without fully comprehending or even considering the potential risks they pose, especially to a vulnerable aging heart. If you are over the age of 60, and particularly if you suffer from pre-existing hypertension or any diagnosed heart condition, it is my unequivocal medical advice to avoid these oral decongestants completely. There are demonstrably much safer and equally effective alternatives. Simple saline nasal sprays, which gently moisten and clear nasal passages, humidifiers that add moisture to the air you breathe, or nasal sprays containing corticosteroids that exert a localized anti-inflammatory effect directly within the nasal passages with minimal systemic absorption, are all excellent and safer choices. Do not allow the temporary relief for your stuffy nose to precipitously escalate into a life-threatening emergency for your precious heart. We now arrive at number 2 on our critical list, a delicate but profoundly vital topic: mental health. Here, I am specifically referring to an older, somewhat outdated class of antidepressant medications known as tricyclic antidepressants, often abbreviated as TCAs. While they are still occasionally prescribed for certain types of refractory depression, their more frequent use in contemporary medicine is for managing various forms of chronic neuropathic pain. You might recognize names such as amitriptyline or imipramine. It is important to acknowledge unequivocally that depression itself is a significant and independent risk factor for the development and progression progression of heart disease. The chronic stress, inflammation, and lifestyle changes associated with depression can directly impact cardiovascular health. Therefore, treating depression effectively is absolutely crucial for overall well-being. However, how we choose to treat it matters enormously, and these specific drugs, the tricyclic antidepressants, can pose significant and serious dangers for the heart of an older individual. Consider the poignant case of Frank, a resilient 78-year-old man who endured terrible, persistent neuropathic pain in his feet, a common and debilitating complication of his diabetes. His physician, aiming to alleviate his suffering, prescribed a low dose of amitriptyline. While the medication indeed provided some much-needed relief from his chronic pain, Frank soon began experiencing disconcerting episodes of dizziness every single time he stood up from a sitting or lying position. One unfortunate day, this debilitating dizziness culminated in a sudden faint, causing him to fall awkwardly and tragically fracture his hip. The insidious cause was later identified as the amitriptyline, which had triggered a sudden and precipitous drop in his blood pressure upon standing, a condition medically termed orthostatic hypotension. This particular adverse effect is especially perilous for older adults, as it dramatically increases the risk of falls, leading to fractures and a cascade of severe health complications, as was the case with Frank. But orthostatic hypotension is not the sole cardiac risk associated with TCAs. These powerful drugs can also significantly accelerate your resting heart rate, leading to a state of constant, subtle stress for an already aging and potentially compromised heart. A perpetually faster heart rate means your heart has less time to fill between beats, reducing its efficiency and leading to increased workload over time, which can eventually contribute to heart muscle fatigue and weakening. And perhaps most concerning of all, tricyclic antidepressants possess the capacity to directly interfere with the heart's intricate electrical conduction system. They can slow down the transmission of electrical impulses within the heart muscle, a phenomenon that is often detectable on an electrocardiogram as a prolonged QT interval. This electrical disturbance significantly increases the risk of developing very dangerous and potentially fatal ventricular arrhythmias, irregular heartbeats originating from the lower chambers of the heart, which can tragically lead to sudden cardiac death. For all these compelling and serious reasons, tricyclic antidepressants are, rightfully, no longer considered the first-line treatment choice for managing depression in older adults. In contemporary psychiatric practice, we now generally prefer newer classes of antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, or serotonin norepinephrine reuptake inhibitors, SNRIs, which typically offer a more favorable cardiac safety profile for elderly patients. However, despite these advancements, TCAs are regrettably still sometimes prescribed for specific indications, most notably for severe neuropathic pain or certain chronic migraine conditions. If you or a beloved family member is currently taking one of these tricyclic medications, it is absolutely fundamental to engage in an urgent and comprehensive discussion with your prescribing doctor. Ask critical questions. Have demonstrably safer alternative treatments for my condition been thoroughly explored and tried? Is my blood pressure being meticulously monitored, particularly for orthostatic changes? And is my heart rhythm being regularly assessed through ECGs? It is vital to remember that mental and physical health are inextricably linked, walking hand in hand. You must vigilantly ensure that the treatment for one aspect of your health is not inadvertently causing serious, long-term damage to another, equally vital system of your body. And now we arrive at number 1 on our critical list. This final point is arguably the most controversial and widely debated topic within the scientific and medical communities, a subject often met with skepticism and even resistance. Nevertheless, it is my solemn duty, grounded in my oath as a physician and my commitment to patient safety, to share the profound concern that has steadily grown and permeated within the most rigorous echelons of the scientific community regarding this particular substance. I am speaking, believe it or not, about calcium supplements. Yes, you heard that correctly and unequivocally. those seemingly innocuous pills that millions of people around the globe dutifully take every single day with the well-intentioned belief that they are robustly protecting their bones from the ravages of osteoporosis. For many decades, the message disseminated to the public and reinforced by health campaigns was crystal clear, almost dogmatic. Consume calcium in abundance for strong bones and a resilient skeleton. However, in recent years, a growing body of meticulously conducted studies and comprehensive meta-analyses have begun to vigorously question the uncritical safety and long-term efficacy of these very supplements, particularly concerning their potential detrimental impact on the heart. Let me introduce you to the illuminating case of Linda, a health-conscious 70-year-old woman. Driven by a proactive concern about the potential onset of osteoporosis, a common worry among women her age, she diligently started taking a high-dose calcium supplement entirely on her own initiative, without prior medical consultation or specific recommendation. Years later, to the shock of her family and medical team, Linda suffered a significant heart attack. What made her case particularly perplexing was the absence of many classic, well-established cardiac risk factors. She had never smoked, her cholesterol levels were consistently within healthy parameters, and her blood pressure was commendably normal. In the intensive investigation to uncover the possible underlying causes of her heart attack, her astute medical team eventually focused their attention on that daily, high-dose calcium supplement she had been taking for so long. The controversy surrounding calcium supplements and cardiovascular health is indeed very real, and while the scientific evidence is not yet entirely definitive or universally agreed upon, the prevailing hypothesis and the observed associations are deeply concerning to many cardiologists and researchers. Calcium acquired naturally from wholesome food sources, such as nutrient-rich dairy products, milk, yogurt, cheese, or a wide variety of green leafy vegetables, kale, spinach, does not appear to pose the same kind of cardiovascular problem. This is primarily because dietary calcium is absorbed slowly and gradually throughout the digestive process, allowing the body to efficiently regulate its levels and utilize it effectively for bone mineralization and other vital bodily functions without creating sudden surges. The problem, or at least the primary concern, appears to arise specifically with the ingestion of high concentrated doses of calcium delivered rapidly from supplements in pill form. When you swallow a calcium supplement, it creates an artificial and rapid spike of calcium in your bloodstream, a sudden elevation that the body's finely tuned homeostatic mechanisms can struggle to manage effectively. Your body, despite its best efforts, may not be able to fully and efficiently utilize all of that abruptly delivered calcium for the intended purpose of bone building, leaving an excess. This excess calcium, which cannot be immediately incorporated into bone, then has to go somewhere within the body. The paramount concern, supported by emerging research, is that this surplus calcium can, over time, deposit itself insidiously within the walls of your arteries. This pathological process, known as arterial calcification, contributes significantly to the hardening and stiffening of arteries, diminishing their elasticity and ultimately making them more rigid. This arterial stiffening is a major component of atherosclerosis and can contribute directly to the formation and progression of the dangerous plaques that are the primary underlying cause of heart attacks and strokes. Some large-scale, meticulously conducted epidemiological studies and clinical trials have indeed suggested that calcium supplements, especially when taken in isolation and in high doses, can modestly but significantly increase the risk of heart attack, while other studies, often with different methodologies or patient populations, have not found this precise connection. The overall body of evidence is undoubtedly complex and requires further ongoing investigation. For individuals with a medically confirmed diagnosis of severe osteoporosis, where the risk of debilitating fractures is extremely high, the potential bone protective benefits of calcium supplementation might, under careful medical supervision, be deemed to outweigh the potential cardiovascular risks. However, the overarching lesson for the general population, and particularly for older adults without a clear medical indication for high-dose supplements, is undeniably clear. When it comes to calcium, more is emphatically not better, and in fact, it can be detrimental. The safest and most physiologically appropriate strategy for obtaining sufficient calcium is invariably through a balanced and nutrient-rich diet. If your doctor, after a thorough assessment of your bone density, dietary intake, and overall health, genuinely believes you have a documented deficiency or a compelling need for a supplement, never, under any circumstances, commence taking it on your own initiative. This is a significant medical decision that must meticulously weigh your bone health requirements against, and very importantly, your individual cardiovascular risk profile with careful monitoring. Today, we have courageously uncovered the hidden, often overlooked, and potentially dangerous side of 5 very common types of medications that permeate our daily lives: anti-inflammatory drugs, NSAIDs, gastric acid protectors, PPIs, oral decongestants for colds, certain older classes of antidepressants, TCAs, and surprisingly, calcium supplements. My central overarching message to you is not one of panic or alarm, nor is it a reckless directive to abruptly cease taking any of your prescribed medications. Doing so, unilaterally and without medical guidance, would be unequivocally dangerous and could lead to severe health consequences. Instead, my profound message is one of empowerment, of intellectual and health autonomy. You are now armed with invaluable, life-protecting information that, tragically, most people remain completely unaware of. You now comprehend that the very pill you take for arthritis pain can, over time, place an intolerable and dangerous overload on your heart. You understand that your stomach protector, while alleviating reflux, might simultaneously be deleteriously affecting your heart's delicate rhythm. You are now cognizant that a simple, seemingly innocent cold remedy can, for an older or vulnerable heart, represent a serious and immediate cardiovascular risk. Use this newfound critical knowledge to become an active, engaged, and informed partner in your own healthcare journey. The next time you schedule an appointment with your doctor, go prepared, not as a passive recipient of instructions, but as an active participant. Compile a comprehensive, exhaustive list of absolutely everything you are currently taking, including all prescription medications, over-the-counter remedies, herbal supplements, and vitamins. Then engage in a direct, clear, and assertive conversation with your physician. Ask incisive questions. Doctor, I have learned that this specific medication, mentioning the name, could potentially carry certain risks for my heart. Given my unique medical history and current health status, is it genuinely still the safest and most optimal option for me? Are there demonstrably safer alternative treatments or medications that we could explore? Should we consider implementing specific monitoring protocols, such as regular blood pressure checks, periodic electrocardiograms, or running specialized blood tests to assess for potential cardiac impacts? Every single medical treatment, without exception, represents a delicate balance between its anticipated benefits and its inherent risks. And that critical balance, I must emphasize, dynamically shifts and changes significantly with age and with the progression of underlying health conditions. Your heart, this tireless, resilient organ, has worked faithfully and tirelessly for you for many decades, enduring countless beats and stresses. It deserves nothing less than the most exquisite, informed, and diligent care you can possibly provide. Protecting its health and vitality is unequivocally the single best and most profound investment you can make in your long-term future and your quality of life. Never, ever take any medication for granted, regardless of how common, familiar, or benign it may appear. And now, I am asking one last but equally important thing from you. Please share your personal experiences, your insights, your questions, or anything that surprised you from this discussion in the comments section below. Your stories and perspectives can profoundly enlighten and help countless others who might be silently grappling with similar concerns. And always, always remember, the conversation you initiate with your doctor, armed with this knowledge, is arguably the single most important and proactive step you can take today to safeguard and protect your heart for a healthier, more vibrant tomorrow. Take exceptional care of yourself.